opportunity to speak with you today, and I would be happy to answer any questions.
Thank you, Dr. Harvard. Our next witness is Dr. George Sheldon. Dr. Sheldon is a professor of surgery and social medicine in the Department of Surgery at the University of North Carolina in Chapel Hill. He's also the director of American College of Surgeons Health Policy Research Institute. Dr. Sheldon is testifying on behalf of the American College of Surgeons. The ACS is a scientific and educational association of surgeons that was founded in 1913. Welcome.
Thank you very much, Chairman Velazquez and Mr. Graves, ranking member, members of the committee. We're also pleased to be here, and I'd make several points on the going in. Neither candidate during the last election could put forward any of the details about one of the big problems in healthcare, which has already been mentioned by Dr. Harbaugh. It's a shortage, and I think if we pick just one specialty to try to stimulate, it's sort of like putting a finger in a dike that's got 10 holes leaking. We've got to do it for everybody. And I know we hear a lot about the problems with American medicine and all the things, and we all agree and we're all committed to health reform. But I'd call your attention to July 4th publication of Lancet, the respected British medical journal. They published a comparison of cancer deaths in the United Kingdom, 11 countries, and the United States using World Health Organization databases. Cancer mortality in the United Kingdom, which has a federal program, as everybody knows, were 23% higher than 6 European countries and 31% higher than in the United States. So my hope, among other things, is that whatever we do for health reform, we don't throw the baby out with the bathwater. There have been some good things happen over the years. We're encouraged by the book by Ezekiel Emanuel. Dr. Ezekiel Emanuel, who is a White House advisor, has a very good outline of a plan that might be done. In the similar void, and on the other side, the June 2nd publication of the Council of Economic Advisors of the White House embraced the concept of a 30% overage that could be money saved in health care costs by reduction in regional variation, by what they call input changes, and also by using the False Claims Act. This is, of course, based on the Dartmouth work, respected investigators, but there's 4 other groups, including ours, that find different types of data, and that would be Dr. Robert Berenson of the Urban Institute, Dr. Richard Cooper of the Wharton School of Business at the University of Pennsylvania, and our data from Dr. Ricketts. In short, while there is some regional variation, they're only comparing Medicare, and Medicare is only 50% of the payers, so it's like comparing apples and oranges. It's not agreed upon enough to be a premise for health care reform. The rest of my comments will deal with shortage of surgeons. There are shortages in every specialty of surgery today. We've done population maps and show that some states are worse off than others, but there's not a single state in the union that has more surgeons than they did 10 years ago, and that's also shown in the Dartmouth Atlas. 1/3 of all surgeons are over 55 years of age, and specialization with surgery as instrumentation and other types of technology increase has been monumental. But to give some data, the general surgeon is sort of the generalist in the group. He's usually head of the trauma centers, does a lot of the transplant surgery, does a lot of the cancer surgery. And we have fewer general surgeons now practicing than we did in 1980. The American Board of Surgery, of which I was chairman at one time, in 1981 certified 1,047 people. Last year it was 1,032. And in the meantime, population of the country has grown by 25 million each decade. Rural America, with about 20% of the population, 59 million people, require on surgical services to keep their hospitals open. That's what allows the hospital to provide the other services. It's the backbone of the rural hospital. There's 1,300 critical access hospitals in the United States, and 300 of them don't even have a surgeon living in the county. If a surgeon is not available, the other services pretty much go away. A further example of the shortage is Cardiothoracic surgery. Cardiac disease is the commonest killer in the 20th century and will predictably be for the first part of the 21st. There are only 50 U.S. medical school graduates applied for training in cardiothoracic surgery this past year. So who is going to do our heart surgery as we go forward? There aren't going to be people around to do it. My closing comments would just say that I would believe that we have a shortage in all specialties, primary care, and all the surgical fields. And we think that there ought to be access to the public programs like Title VII, the National Health Service Corps, the DISH provisions that are provided for primary care and others. These things ought to be made available for all specialties, not just primary care. Thank you very much for your attention, and certainly available to provide maps of all these states and everything if you'd like to see them. In fact, you have one map with you, I think.
Thank you, Dr. Sheldon. And now the chair recognizes the gentle lady from Pennsylvania, Ms. Dahlkemper, for the purpose of introducing our next witness.